Hello everyone, I am Dr. Aslam and today I'm going to present a case report on a rare case of solitary cystic mediastinal lymphangioma in an adult female. Lymphangiomas are rare congenital malformations arising from lymphatic sacs. They frequently present by 2 years of age and they usually are present in the neck or axillary region, and less than 1% of them extend into the mediastinum. Lymphangiomas account for 4 to 5% of all of the mediastinal tumors. So here we present a case of a 42-year-old woman with obesity, hyperventilation syndrome on 4 liters home oxygen, a history of 20 pack years smoking, and hypertension, who presented with worsening dyspnea and productive cough. Her dyspnea became worse on lying flat and with activity, and it became better with in a sitting position. On physical examination, coarse bronchi were heard bilaterally in all lung fields. Her chest X-ray showed large right mid-lung opacity of low attenuation, which was not present in a chest X-ray that was done a few years back in our hospital. So, based on the chest X-ray, a CT thorax was done, which revealed a cystic mass in the right side of mediastinum without nodularity. It was almost 9 by 6 centimeters, and it was seen encroaching on the superior vena cava and approaching the trachea and mainstem bronchus. So the patient also had like extensive workup done in several other hospitals previously. So the mass was first discovered 3 years ago in another hospital, and over there endobronchial ultrasound guided transbronchial needle aspiration was performed, after which the size of the mass decreased, and the pathology report just showed bland lymphocytes, and they thought that it was a bronchogenic cyst. And then the mass, a week before her presentation, she went to another hospital where the mass had again increased in size, and they did a CT guided biopsy which showed a benign cystic lesion lined by posicellular cells with rare histiocytes and proteinaceous debris. Based on all these previous results, a presumptive diagnosis of bronchogenic cyst was made, and pulmonology and cardiothoracic surgery were on board, and they decided that, considering the size of the mass and its recurring nature, it is better to remove it. So an endarterectomy with tumor resection was performed by the cardiothoracic surgery to prevent the further compression of the tracheobronchial tree. So the capsule, the fluid was removed and the capsule was retracted from the surrounding structures, and it was sent for pathology, which confirmed the diagnosis of a mediastinal lymphangioma. The postoperative hospital course was satisfactory and patient was discharged home in a stable condition. And so, mediastinal lymphangiomas are extremely rare in adults, and majority of which are silent tumors, but a failure to make an early diagnosis can cause complications like respiratory difficulty, hoarseness, and superior vena cava syndrome. Hem-onc was also brought on board for this patient, and they counseled the patient regarding the benign nature of this tumor, but there is a high rate of recurrence. After the endobronchial ultrasound guided transbronchial needle aspiration, there is a recurrence rate of 50 to 100%. Whereas the rate of recurrence with surgical excision is 10 to 50%, and even lower with radical resection. However, the complete surgical resection can also become challenging once the tumor has infiltrated the adjacent structures. So the learning points from this case report is that even if found incidentally as a cause of mediastinal widening on chest X-ray, it is important to consider lymphangioma as a differential diagnosis, followed by further imaging and biopsy as necessary. And sometimes the biopsy alone cannot yield the final diagnosis, and surgical resection is the only option. And also, prognosis is excellent after complete surgical resection, with similar survival between patients and controls according to a Mayo Clinic study. This case also highlights how timely intervention with mass radical resection can prevent clinical complications from this rare benign tumor.